again. I'm going to keep saying that because I'm going to come back again. I am very proud to say 1 chemo treatment down, 3 more to go of the Red Devil. But other than that, I must be honest, I actually feel really good. Obviously it's scary because you don't know what it's going to feel like, and it felt like nothing. There's no pain. The only time there was pain was when the nurse couldn't get the drip in. Well, not the drip, I don't know what it's called, but so that was sore. But then when she did get it in, chemo was good. So amazing. Offered me coffee and tea and sandwiches, and so when I got there, I had to sign in, and then the nurse comes to fetch you, and before every chemo they check your weight and your height. Then before it even starts, I got 2 nausea tablets and 1 antihistamine. The antihistamine is to make sure they don't have any allergic reactions to the chemo, and the anti-nausea is exactly that, for anti-nausea. Sorry for the noise, we're busy cooking dinner. Anyway, so after that, then I needed to have that in my system for an hour before they could start to infuse. So once I'd had the pills, and they gave me some breakfast because I didn't eat, about 9:30 they started with the chemo. So I first did the red one, which is it's a small little bag of, I'll pop a photo up online for you guys to see. It's a small little bag, and like the chemo is literally red, like red, like it stains your urine, like it could make your sweat red, your tears, all of that. But it only stays in the system for, I think it's like 24 hours, but then the more liquid that you drink, the quicker it gets out of your system. So I've already started noticing that my urine is back to almost yellow. So then she sits with me while she's doing that chemo, only because of 2 reasons: that they need to make sure that when it's going in, it's actually in the vein, even though my vein is bleeding, whatever, that it's in the vein and it doesn't go red or itchy or swollen in that, around the area. Then they need to stop, they need to pull it out, because then the chemo is going under my skin instead of into my vein. It's quite scary though. You're just sitting there like this in your normal attire, and you come back from the bathroom and she's about to start your chemo, and she's got like safety glasses on and a mask, and she's double gloved, and she's got this like plastic suit that she's got on, and then she like cuts open the bag that the chemo was in, and it's like double bagged and it's sealed, and I just felt like, oh my goodness, you're so covered and taking so many precautions with your PPE, and yeah, I am having it put into my veins. So that was a little bit scary, because the reality of it is that it is poison. But then when she was finished with me and she was going to see her other patients, I was the only patient there today that had the red, that had this harsh one. Well, but then when she goes to see all the other patients, she removes all of that and she deals with them. And then when that one was finished, that one took about 10-15 minutes, she had to come put in my second chemo drip, which was that other long name, and that one had to be put through a line. So I'll show you on one of the photos that I've got there. It's actually this little machine that they put the drip line into, and that regulates the chemo going through that into your body. And that's, they only want it to be an hour, and the medication's up, the machine beeps, and then they come and remove the drip out of your arm, and off you go. But in and amongst all of that, while I'm sitting having the chemo treatment, it's absolutely amazing, because I had the pharmacist come in and she gave me this amazing pack that's got like a thermometer, which I'll explain, and some really good Mugu products, which is like, it's actually the chemo care pack, which is nice because it's got cream and cleanser and lip balm because my lips will get quite dry. Also in there's a soft bristle toothbrush, I'll explain too, and then some mouthwash and some teeth and some toothpaste. And so that's nice because it comes in this little bag, which is quite cool. And then you know, chemo just keeps on giving, because after getting that pack, she came and gave me a whole bag of drugs. Not the good type though. But so I've got nausea tablets. They only give you 2 for 2 days that you take, and then another one called, I think it said it was called lorazepam. So I've heard the name before, but yeah, I got lorazepam. I take 1 for 3 nights, and then that's done. And they gave me other nausea tablets to take in between if the main ones aren't doing what they're supposed to. And it's so weird. So like it comes in this packet, and then when I'm finished the medication, it has to stay in this packet, and when I go back to them, I have to give it back to them with the empty bottles and everything so they can dispose of it properly, as well as after the treatment, I'm supposed to have an injection. So I'm supposed to go tomorrow for an injection in my stomach, but I've decided that I'm going to do it at home. So they gave me the medication to bring home. It will be 1 injection that I need to do 24 hours after receiving the chemo in my stomach, which is fine. I'm a big girl. And then it's only a once-off injection, and it's like got a retracting needle. So once I've used it, the needle retracts. I put it into the same bag that they gave it, and when I go back for my second round of chemo, I give them all the empty packaging so that they can dispose of it correctly and properly. They don't want me to dispose of it or throw it in my normal waste, which I thought was quite cool. Then after having that from the pharmacist and discussing all of that, they've already given me my next time and date for my next chemo. I have a follow-up appointment with my oncologist on the next week, Thursday, just so that she can touch base and see how the first round has gone and if there's any side effects or anything like that. And to be honest with you, so far so good. I haven't had any side effects. Well, maybe being a little bit tired is one of the side effects, but I actually think it might be more from the antihistamine that they gave me this morning. I have felt a bit weird though. Like, they say it's called chemo brain, but it's weird to explain. So like, if you go on to a roller coaster and you get off the roller coaster and your body and your mind still feels like it's on the roller coaster, so you're not dizzy, but you're like hazy almost, kind of feels like that. Got a bit of dry mouth, but I've been drinking some water, and those are generally the only things that I've got side effects wise so far. Oh, they did say my hair will start falling out already tomorrow. The breast nurse Mel, so amazing, she actually said to me, because my hair is so long, she would recommend that this week or weekend or whatever, just to trim it, to cut the weight off, because she said if you don't, when it does start falling out, because it falls out randomly and sporadically, it could become quite matted, and then that's worse to try and deal with. And then she also said that, she said it's a weird sensation, it's a weird feeling. She says your hair follicles and your whole head start tingling when it's going to fall out. And she says that it's only affects your hair. They have, so I said to her, I'm just worried, is it going to affect my eyebrows and my eyelashes? Eyebrows and eyelashes we want to keep. But then I said to her, like other bodily hair, like armpit hair, leg hair, like, yeah, I'm thinking I've spent all this money on laser treatment, and hopefully it's all just going to fall out. But no. Surprisingly, she said it does not actually affect eyebrows and eyelashes and the rest of your body hair. She said for some reason, chemo treatment only affects the hair on your head to fall out. The chemo nurse was actually saying that she's only treated 2 patients ever, and their eyebrows have fallen out, and they've been men. So, yeah, so it's quite weird that it would affect your head, but not your eyebrows or your eyelashes. I mean, like, sometimes you need to get rid of this little moustache, you know, but who knows. So there was that, and then she mentioned that I need to do things like wash my hands all the time, after everything, after I eat, after I cook, after I go to the bathroom, like literally keep my hands clean because of a couple of things. Because the chemo is going to not only attack the good cells and the bad cells, what happens is that my immune system is going to be very low because my white blood count is going to be very low. But we've got this amazing injection, which I will do tomorrow, which is you do 24 hours or as late as possible after your chemo. And what it does is it causes your white blood cells to like multiply or tripleply, whatever it is, so that your white blood cells are working overtime and producing faster than what the chemo cells or the other cells are being killed by the chemo. So that's why they want you to do it 24 hours, because chemo actually only stays in your body, I think they said like 48 hours. So then when the chemo is already starting to come out your body, you've got the white blood cells doing their job. She did say one of the side effects of that is that I could possibly have aches and pains because of the bone marrow, because apparently your white blood cells, I think, come from your bone marrow, something like that. I don't know, but she said it was going to be sore, like I might feel like aches and pains, but it will be gone after that. Other things that you never thought of, for instance, I cannot kiss my kids, which is a bit sad, but only for 7 days, and that's because chemo is poison basically, and they don't want my bodily fluids to get one of my kids to by accident give me a kiss on the lips, and I've got chemo in my saliva, and now they got it. And we just keep all those things to a minimum and precaution wise. So for 7 days, no kisses, but definitely heaps of cuddles, heaps of love, heaps of, they can kiss me on my cheek, or I can, kiss them on the back of the head or on their head or wherever it is. It was quite strange. They did say that maybe limit them and Eladio using my bathroom, only because, again, of my body's waste and my body's, I don't know what's the word, my body's excretions, I don't know. So like, if I'm very sweaty, I need to take my bedding off with gloves and wash it alone in its own cycle and dry it. And then once it's dried and washed, can carry on with normal. Like the kids aren't allowed to share my lip ice or my drink bottle or anything like that. Same thing on the toilet, only because like if you wee or whatever and you flush it, it could come out the toilet when you're flushing it. So just those sort of precautions. Then some amazing things that they did today. When I was having the red chemo, the red devil, I was sitting down and the nurse said to me, I need to please have those, like she's given me these ice chips. I'm like, oh, I'm not thirsty, thank you. She's like, no. With the red chemo, you will keep eating ice chips the duration of your chemo, that red bag. Once that red bag is finished, I can stop the ice. So I just asked her why, and she said to me, no, because they want to keep my mouth and everything in my mouth cold, really, 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 really cold, so that the white blood cells don't start working yet in my mouth, because they want to prevent mouth sores, because a major side effect of this one is mouth sores. So she said, the colder we keep your mouth, your soldiers go dormant because they are cooling down. So we want them to cool down so that by the time that you finish the chemo and you've finished your ice, they will wake up and they will be more of them in your mouth, checking, scanning, making sure that everything's good so that we can prevent mouth sores, which I thought was quite cool. Also helping prevent mouth sores, they want me to rinse my mouth after every meal with salt water, and brush 3 times a day. Like I said to you, with a very, very, very soft brush. And then they've also given me this to try it out. It's a mouthwash, which they said was quite nice. Because I'm going to have dry mouth as a side effect, they said I should be chewing like bubble gum or, you know, sugar-free gum and stuff like that in the day, just to help with the saliva. Because even though I'm drinking a lot of water, it still doesn't take away the dry mouth. And then they explained to me something which is a little bit scary, but I suppose now that my immune system is going to be down, if I go out in public, wear a mask, don't be around people that are sick or that are getting over the flu or something like that, that have got a cough or a snotty nose or anything like that. They don't want me to get sick. Then if I do get sick, I've got my own thermometer that I have to use. My temperature must not get over 38. If my temperature gets over 38, it's immediate rush to emergency, ICU, only because of my immune system being down. My protocol will be different. So if you are a normal, healthy person, not that I'm not healthy, but I'm saying if you don't have this ailment, you can have a high temperature and you can get it down at home by having Panado or Nurofen or ibuprofen or Panadol or whatever it is, where they don't want me to do that because Panadol and ibuprofen and Nurofen actually mask the symptoms of me being sick, and they're worried about an infection. So when I go to the emergency unit, I've got a red card. It's in my wallet. It's actually a card. It's a red card. It's got my name. It's got everything I'm going through, what I'm on, and then I will give that through to the staff in emergency, and they'll know exactly that they need to deal with me differently. My protocol will be different. My drugs will not be like they first monitor you and give you Panadol to see if symptoms subside. Mine will be straight to antibiotics immediately to help get rid of any infections. So I just have to be more vigilant about infections and that sort of thing. With my blood, with my white plate, my platelets going down as well. Obviously, I'd bruise a lot easier. If I do cut myself, it's going to bleed a lot more. So it's just little things to keep aware and be cautious of. But other than that, so far today has been a really good day. I Ubered there this morning. I got some little videos and some pictures. I'll put that online as well. And I Ubered home. So fancy. I came home in a Polestar. I love that car. And yeah, I've been good. Obviously, I had a really good friend help with bringing the kids home today. But tomorrow I will sure be okay to take them to school and fetch them. Just some other fun facts. Like she saw that my nails have been just redone. And she's like, oh, I see you do your nails. She says, yeah, some patients do that because sometimes their nails flake and go black. But then they will heal, but it's just unsightly for them. So I said, oh, okay. So I just really done that. And then she also said to me that some patients get really sick the next day or 2 days after. Just take it easy, take it slow. But I think that's overall, it was a good day. Had a good treatment. The place is beautiful. It's very, very nice. They've given me another pack of information to bring home so that we can read up a bit more about it. They've given us another pack. Then when they give you this pack, which is quite cool as well, is already they've got my outpatient blood form that I have to do the day before my next chemo. I've already got my visitors scheduled, so I know when I'm going back to see the doctor for a follow-up, when's my next chemo. They just tell you how to handle things like constipation and diarrhea, because apparently that's one or two of the side effects. Obviously eating a lot better in terms of food. And I didn't realize it, but they said I have to stay away from grapefruit. Maybe I've already said this. I have to stay away from grapefruit and grapefruit juice because they actually interfere with the chemo, which is quite strange, actually. But other than that, I can eat fruits and vegetables. I can eat normally. Don't change anything there. Obviously, no alcohol, but we only drink around our family, so that's fine. We have none here. And no acidic foods, only because of this whole thing they're worried about with mouth ulcers. Oh, and then very interesting is that they said that I should be doing at least 30 minutes a day of light exercise. For the simple fact that two reasons. One, it's going to help fight fatigue. But the main reason that they want me to do at least 30 minutes is that they've shown that it actually helps to, with your blood flow around your body, it's making the chemo go around your body even more and faster and whatever. And it actually helps with the effectiveness of the chemo. So the more I exercise, well, not the more, those 30 minutes that they want me to do every day will help with the effectiveness of the chemo, and it will also help with side effects. So like not having the tingling feeling in my fingers and my toes, which would be like the start of nerve damage, or fatigue. It will help with nausea. It will help with my sleep. It will, so many benefits. So we will start doing that from tomorrow. So I just wanted to give you guys a heads up that everyone is doing all good here. The girls have been phenomenal. They are so inquisitive, but we'll let them each do another video. I'll upload that once they've done, just so that you can also see from their perspective that I'm not just being overly positive, that we all actually quite positive, and we all, especially after today with the unknowing of the chemo, like it doesn't even hurt going in, it doesn't feel different, it doesn't make your body feel strange, none of that. And I think now that I'm aware of what's to come, it makes it a lot easier to manage. You know, as they say, there's only one way to eat an elephant, and that's one bite at a time. And it's the same as this, you know, like in my Uber today, actually on my way there, a young girl wanted to know, who was driving, wanted to know why I'm going to the hospital. So I explained to her, and she said, I'm so sorry to hear that. And she was so sympathetic and apologetic that I had it. And I thought to myself, you know, you don't have to be sorry. Like, I'm sad I've got it, but I'm not sorry. There's nothing I can do about it. There's nothing I can go poof and it's gone. I just have to deal with it step by step, going through the motions, going, you know, listening to my doctors and nurses, and having that support team around me, knowing that it's going to be okay because of the way that they are structuring things. And, you know, she let out telling me that her partner, who is only 19, has had to have a heart operation because his heart muscles are too big. So he can't do any heavy lifting or sports or anything like that. He could have a heart attack. And I thought to myself, you know, dealing with cancer is tough, but there are so many things that doctors put in place and treatment plans that can help you, are beneficial, can get rid of this thing. I can kick its ass and be fucking done with it. Where something like that at 19, I think for me, having a diagnosis like that is more earth-shattering than having cancer. Cancer is a gross bug that you can get rid of, where you can't very well get rid of your heart. So I just want to leave food for thought. I know it's a bit dark and maybe a bit emotional, but we are honestly doing well. Today was a good day. We'll see how we are doing tomorrow. I might do a video tomorrow, but not upload it. I'll just see how I'm feeling, because I'd like to give you guys the realist steps through this whole thing. Like, I don't want it to be like, oh, I've edited this and I'm feeling great and my hair is amazing and my skin's glowing. And no, I'd like to show everyone the reality of it, because that's life. Life goes on and we move on and we get stronger for it, and we become better people after we finish hardships. And I think that that's, might be people on here that are not religious, well, I am, and I honestly believe God doesn't make you sick. No, he's not going to be like, I'm going to give you cancer and let's see if you can play the game of survival and beat this thing. No, he doesn't give you cancer to watch you die or survive. I think that it just happens to be a product of our genes. I just got a bad gene, and that's what it is. But I do feel that God has a plan and a perfect path for everyone's lives. And I think that people get stuck up in the negativity of the situation and don't see the lighter side of things, and don't see the positive. Like, God would never give you something that you would never be able to handle. And for us, having moved to 2 different countries, we are strong. Our family is just a little family unit of 4, but we are strong and we will get through it. And with the support that we've been getting from friends here, it's been amazing. So heads up, chins high, we'll get through this together and come out better on the other side, and we'll take it from there. So have a wonderful evening on my side, but morning on your side, and we will chat again. Thanks guys, bye.